in Brookings, although it was awfully nice to be gone for a good part of the winter. Glad to get out of here, and I just can't thank Joni Holm enough. She covered, I think she was here every single week, wasn't she?
Absolutely.
My goodness, is she resting up now?
Yeah, it was such a trouble
So
thing,
much
messing
work for
around
her.
with having a
Yeah.
conversation with me.
Yeah,
I mean,
well,
always,
she has to be pleasant to you for a half an hour.
that's right. And then, that's it for a half an hour, and
That's
then
it.
we're
She's
back to
done.
normal again.
No, she did a great job, and I really do appreciate it. We should probably start today's program, so I'll give it an introduction. I'm Joan Hogan, welcoming you to the Prairie Doc radio program. Rick Holm, our Prairie Doc, is here, ready to answer your questions of a medical nature. Dr. Holm's specialty is internal medicine. He's a primary care physician with the Avera Medical Group Brookings, and he's also a clinical professor at the University of South Dakota's Sanford School of Medicine.
Ooh.
Good morning, Dr.
Good
Holm.
morning, Jonah Hogan.
One other thing, we do have a guest in the studio. Before I introduce her, I'd like to remind our listeners they can live stream this program on their computer. If you'd like, you're listening on the radio, if your computer's nearby, we're on the web at prairiedoc.org, O-R-G, not that, prairiedoc.org. Pull up the page, choose radio, and you'll see the arrow pointing to our program today, and you'll see us as well as hear us.
You can even, and it's amazing. Have you ever watched Prairie Home Companion on
Yeah.
TV?
Oh,
or on the computer?
I have not watched it on the computer.
Yeah, you can watch it on the computer, and it is just amazing. And so, I mean, it's fun to see.
We're not amazing, but we're
not
here.
that amazing.
No. Okay, so you can live stream us, but if you just want to listen to the radio, we're happy to have you listening. And today, you can listen to a very qualified young woman. Bev Cotton is a registered nurse, and she has worked with the Brookings Health System for quite a few years. I want to say diabetes coordinator. Would that be the right term? What would be?
Educator.
Educator. Diabetes
I try to
educator.
coordinate, but
Well, Bev,
that's not high on the list of things I can do.
We're always happy when you hear about it. It's
Thank
just
you.
a pleasure to have you with
It's
us.
fun to be here.
Thank you for joining us. Well, tomorrow night's television show is on call with the Prairie Doc is with Mark Oppenheimer. Mark is an endocrinologist from Sioux Falls, and he's really a character, actually. And the first time I met him, I was at a medical meeting sitting next to him listening to a lecturer, and he was knitting. And I thought, now that's an interesting thing. His wife is Matilda. And she's a delight. I saw Matilda again last fall when I was getting ready to run the half marathon. Mark was dropping off Matilda. Matilda's this short little thing, and she was getting ready to run the half marathon too. She's my age. And,
So the two of you ran it together.
well, I don't know where she was in the pack. I was kind of in my ears listening to KBRK. And
Of course you were.
So, but the whole story is that Mark Oppenheimer will be here tomorrow, a very interesting man, and we'll talk about all things endocrine, thyroid disease and hormonal things and all those things. But the biggest endocrine issue that we deal with on a regular basis in medicine is diabetes. And when we started talking about diabetes, we thought about Bev Cotton. Because
Always
she's our
think of Bev first.
Yes, because she is supreme diabetic educator. We lean on her all the time, and she is her independent little self over in the corner, teaching them these wonderful things. And we really lean on her to teach us things too. Thank you for being helpful to our patients and helping with this regard.
It's a pleasure.
We're glad to have you here. We do take a few breaks during this program, and for those of you listening who may have diabetes or have a close friend or family member with diabetes, if you have any questions, this would be a great call-in program for you, 692-1430. If you give us a call, I know Bev or Dr. Holm would be glad to respond to any questions about diabetes.
It's the questions that make this a lot better show. So help us. Help us be a really good show. Give
That's
us a call.
Great idea.
692-1430.
And we'll take a break and be back right after these words. Dr. Holm, you gotta stop laughing. No.
Oh,
We just heard a sad story from Bob.
Bob said
Flushed
glass,
his glasses
turbo
down
flushing
a toilet.
glasses. Really, he flushed them right down the
Okay.
old flushing.
I wasn't gonna fish them out, so.
No, that's not true. They're gone. They're
So
all
I
gone.
have a reading glasses story.
You do. What's your reading glasses story?
So we sailed into harbor on East Joost Van Dyke. Beautiful harbor, one of the prettiest spots in the whole world. And we took the rubber dinghy with all 8 of us into the dock, and then we hiked into the Bubbly Pool, which is this fabulous place, British Virgin Islands. And then we hiked back to have a celebratory glass of rum of some kind, as we looked at the palm fronds waving. This is on a January day, looking out over the water. And I decided I would go down and get some stuff and bring it back to pick up people. So I'm down on the dock, and a woman who was obviously the captain of her yacht group, whatever, was telling them, get in, get over here, get over, don't step on the glasses. And she looked down and she picked up these glasses and she looked around and she said, would you like a pair of glasses? And I said, sure. And she said, okay, and tossed them to me, and I caught them. And I said, what happened here? She said, we found them. We were snorkeling. We found them in the drink. Somebody must have
Lost
leaned
their
over.
glasses.
They came down and we retrieved them. And, they're probably not any good, but,
Here you go.
And I thought, okay, well, they were kind of encrusted with barnacles. They were.
They had been
They'd
down there
been
for a
down there
while.
for a while. The glasses part seemed to be okay, and I just kind of rinsed them off and put them in my pocket and put them in my backpack, and then they came home with me. And then I took a little time to clean them off. And they have a little character with the barnacles here and there, but they see pretty good when you're at home at night. And so I have just the opposite. Maybe these were your glasses.
A barnacle
And they were-
encrusted reading glasses?
Yeah.
Did they say Davy Jones?
Yeah, Davy Jones's glasses.
I can't believe you saved them.
Isn't
You
it?
did.
They work.
Oh,
And my
well, there
wife
you
says,
go. You wouldn't
well,
want
you
to
got
waste
another pair of
anything.
those reading glasses that don't have all those little bumps on it. And I said, I kind of like the bumps.
You like the barnacles.
There's a story there. Bev, you've
Okay.
been sailing in the British
Yes,
Virgin Islands.
yes, somewhere around that same area, there would be a Brookings Marathon hat that flew off my head. So I'll have to purchase a new one. And by the way, that's coming up real soon
The
too.
marathon.
That's a wonderful
Yeah.
thing.
Yes,
Are you going to run it?
No, I'm on the committee, so I help Dr. Bean with it. So it's kind of tough for me to run, but I am running the half marathon the following weekend in Fargo. And then 2 weeks later, I'm going to be running the half marathon in the Deadwood Trail in Deadwood.
Oh,
So,
you're going to do 2 in a row?
yep,
Wow.
2 weeks apart.
Wow.
So
That's one way to stay healthy. You got to work up to
You don't
it
have
too.
to
I
do it.
tell my patients to do it, so I feel like I
Even
have
the
to do it
diabetic
myself.
patients, right?
Yeah. Oh yeah.
Oh, to be running.
So
Oh, yeah.
how important do you think exercise is for diabetes?
I think it's probably goes 50-50 with, your lifestyle changes need to be both your diet and your exercise. I think exercise is just as important as diet, sometimes maybe more. Not all people can exercise, but I feel that they need to have some sort of increase of activity every single day, just to kind of burn that sugar and keep their sugars under control.
I like the idea of relative exercise. That means not having your wife run for you. That
That would be
relative.
relative, yes.
But relative to what you can do that. And then gradually over time, relative to what you can do,
Right.
keep exercise.
The recommendation from the American Diabetes Association is to do 150 minutes of aerobic exercise every week. And so aerobic, meaning you get your heart rate up there a little bit to the point of where you can't really hold a conversation without maybe having to take a breath or two.
In between the conversation,
in-
just at the edge of conversation.
Right.
So you're pushing yourself a little
So
bit.
yeah, you push yourself a little, and I feel, and that's kind of why I myself personally like to push myself a little bit and go a little bit longer distance, because I feel that that's the way you push yourself, and I think that's what patients need to do is you can't get comfortable at something. I think you every day you have to kind of push yourself, and that's the other part of it is once you can just keep going.
So, I want to say this. I was talking with AD exercising, and he says, well, there's no question about it. A lot of people my age just quit. They're done with they're done. They sit down and they melt away, and they mean something when you get older. And my point is that when you're in your middle age, or you want to stay in your middle age, then keep moving,
Yeah.
so that you don't move so fast.
For those listening too, it's kind of good to know, both of you have exercised in my 50s before I got into it. So if you're 50 or 60 and you've never exercised, been doing it your whole life, you can start now.
So you've been gone for
I
a
have.
month and a half.
I have.
What'd you do?
Did sunbathing with my SPF 30, according to Dr. Holm. Man, I just wanted to hit him. I thought, I've got color, but I really make sure that I don't get burned. I want to enjoy the sun. I do exercise, and I have a bike down there, so I bike. And so biking and walking are my two main exercises. But I think I've really missed the aerobic class that I take up at the Wellness Center, because I still felt kind of stiff when I got home. And I started doing that, and I feel good again. So that makes a difference. I wanted to mention, too, when Bev said some people might be unable to exercise, there's a class at the Wellness Center that starts after mine is finished, and they bring in chairs. And these people do exercise sitting down in a chair, and there are 20 to maybe, sometimes, I think there's 30 people in there. And they really don't, I don't think they have the ability or yet have moved up to the fact that they could do more than sitting. But sitting, they are still doing aerobic exercises. I think it's phenomenal. I really
great.
do.
Part of what I'm going to be doing after my July 1.
Soon,
Yeah.
July 1.
I will be doing patient education. Thank you for that.
Not that you have always doing
It
patient
was,
education.
we've got a new doctor coming in September. The doctors that be and kind of using up space and doing and taking up patients when they're patients, and so
It'll be a sad day, but before you talk about your new realm, we are going to take a break, and then all of us want to hear what you are going to do in your next occupation.
Yes.
Clear.
Throw that in. Okay. Yes, Ed was very sad. He said, well, Dr. Holm quit on me. Prairie Doc Radio. We're happy to have you listening today. I'm Joan Hogan. Dr. Holm and Bev Cotton are both here. And Dr. Holm was just ready to tell us what he plans to do in his next life.
We're going to be doing a research project through SDSU, so that it's Bonnie Specker and Teresa Binkley are helping me coordinate this, so that it is pure science. It's going to be every effort to try to make sure that we do it in a scientific way, that it actually proves that which we're trying to do. I mean, I have utilized science all my life in practice. I want to advance it. And this is advancing it, using these good research brain people to set up a protocol. Now, our protocol is to strengthen people who are older or getting older or overweight. And our effort would be as a group to try to enhance their strength so they don't fall. And so if you look, or they don't, so they're able to stay young. I mean, if you look at the data, it says that it isn't the person's weight that matters in their ability to live long and well. It's their strength. So that, walking is aerobic, but there's also the strengthening part of it too. And we're going to combine this with a dietary educational bent. So it's going to be a research project that we'll be throwing out there. And I haven't completely defined exactly how we're doing it. We're going to probably be using Wii boards. You remember those Wii?
No.
Wii exercise, WII,
Yep.
and they
Oh,
can do golfing and you can do sword
That's right, I
sword
forget.
fencing and I mean, all sorts of parts of that, but we're going to use the Wii board to test. And we may well use the Wii board to enhance their strength. But more to come. We're right now going to Germany. Coming up, we're going to go to Germany and talk with the world's cutting edge experts in strengthening to prevent falling. So we're doing our preparation right now. It's
Well,
kind of
that's great.
exciting.
Well,
So
really
it has to
exciting.
do with the exercise, Bev.
Right.
But let's talk about diabetes a little bit more. What you end up doing a lot of education about diabetes, and my essay today was about that you'll see coming up was about too much insulin. And so we can talk about insulin. We can talk about type 2. What is the thing that you think people would learn the most from you, and is the most important lesson that you give to people?
Well, it kind of depends on where they're at in their diagnosis. I think sometimes just to re-educate them about, what is carbohydrate, to remind them. I would say some of the older patients forget that fruit is a carbohydrate, that milk is a carbohydrate, those kinds of things, and that it does make a difference if it's, if am I going to eat a caramel roll for breakfast versus a bowl of cereal. Yeah, there's going to be some difference with the way your body breaks that down and probably how quickly, but the bottom line is it's still a carbohydrate when you eat that bowl of cereal. And I think that is a misconception that a lot of people have. They think that as long as I stay away from sweet
Caramel
stuff, I'm fine, and their blood sugar reflects that. And it's a very individual disease. They can do what they want to, if they want to, as much as they want to. And I think when it comes to insulin and dosing, that kind of stuff, I think that's where it's really hard for the physicians to make those adjustments, because I don't know that people are always that truthful about, well, I don't do any of that. Well, then why are your blood sugars high? Not that we want to be pointing fingers at them, but it is a direct relationship to what they're eating.
Right.
And so it's really tough.
So there's a lot said about carbohydrates and diabetes and aging, actually. And of course, we know there's certain carbohydrates that are really good. I mean, we push fruits.
Well,
we push milk.
we need carbohydrate. It's not that we want to exclude them. We just need them, and we want to have the complex carbohydrates more than the simple carbohydrates.
And probably would like to control the quantity.
And the quantity. The portion size is huge.
I've read a little bit that premature aging can occur with diabetic patients. Why is that?
I would say it's probably more because of the whole vascular system that's going on. When you think about what's happening on the vessel end of your body in relationship to diabetes, it's impaired blood flow, and so impaired blood flow to the brain, to the arms, legs, heart, wherever your blood flows, you're impaired. So,
Okay.
You're going to see differences with that. Just like you would have a heart condition, you're probably going to see aging quickly.
Right. I mean, aging has a lot to do with the vascular system. I mean, it carries oxygen and nutrients and everything to every single cell of the body, and when those get blocked, you have a heart attack, you have a stroke, you have a kidney, and they say that 80% of deaths are directly related to blockage of the vascular system. 80% of the deaths. You take the nursing home care, the end of life. You look at all of the people who, it's not, and of course, living in a nursing home doesn't mean the end of life is coming, but if you do the studies and you look at where people die and how they die, 80% of the deaths in the end of life in an advanced elderly person is vascular. And diabetes enhances that aging process,
Right.
makes it happen faster, as does smoking.
Right. I was just going to say, I don't know what the statistics are, but I would guess that of that 80% with a vascular problem, there's probably about 50% of those that are also diabetic, don't you think?
Just huge.
Yeah.
Are there certain vitamins that you really encourage diabetics, or that isn't that important?
Well, I think this is a Dr. Holm theory, that if you're eating a balanced diet, there really should be no need for vitamins.
Okay.
Because you're getting everything you need from the foods that you eat, and that's the natural way of getting them.
Boy, I just think that's it. I mean, except for maybe vitamin D in
Vitamin
South
D.
Dakota. If you were in Florida, you may not have
Yeah.
that problem, but in South Dakota, half of the year, you don't get enough vitamin D.
I got to ask you, when you mentioned when you're in Florida, someone said, well, you use that sunscreen every day, you're not getting vitamin D. It doesn't
Yeah.
make it through. Is that true?
It blocks the vitamin D absorption. But I just had a discussion
I
from...
can't win.
No, you can't. Yeah, but a guy from Iowa makes a big fuss about, oh, well, it doesn't take much sun for you to get enough vitamin D, and the answer is,
Yeah.
I think enough. If you study people, you check vitamin D levels, particularly in people who are overweight. They're low in this part of the country. I bet a third at least are less than 30 or 25. A third of them. Particularly if they're heavy, it's 80%.
Well, you don't want to stereotype, but it would be interesting to know what their exercise habits are then if they're overweight, and do they exercise outside? Are you
Yes, you
outside
can.
and doing that?
Yeah.
You're outside, you'll get some vitamin D, right?
Yeah.
Even
Yeah.
through the winter, you get some vitamin D, and they say, particularly for
Except
the
when
emotions.
you run at 5 o'clock in the morning.
Well, yeah. Is that when you run?
Yeah,
That's when you
5
run.
in
Yes,
the
that's when I
morning?
run.
Oh,
Don't get a lot of vitamin D during that period of
No,
time.
no, but you do get your exercise,
Yes,
and it's
I
a
do.
wonderful thing. You
Yes.
can take a capsule of 2,000 vitamin D, and then you're okay.
And you're good.
So we can argue. There's all sorts of things that we don't really understand. I would emphasize this, that of all the things in science that that have been advanced, and these things, and I have to say, a lot we don't know. And if you look at it, nutrition science, although it has made huge advancements, it's still almost in the dark ages. We think that it's good to eat this. We think that it's good to eat that. There are these allergies that we don't really understand. I'm right now getting ready for an allergy show in a week and a day. The allergy show will talk about the fact that one person may be allergic to latex, like you, Joan, and not me, not Bob, not Bev, but you're allergic to latex. Well, why is that? 85% of the public are allergic to poison ivy. 15% are not. Why is that? 15% are allergic to nickel, and 85% are not. Why is that?
We don't
Everybody's
know, do we?
different. And when you eat things that are different, you may be allergic to this, you may be allergic to that. Things are, every individual so different.
Right. And that's why teaching diabetes education is difficult, because you can give them the guidelines, but
They're
the
an
way
individual.
the way they're going to react to it is so individual. So
Everybody's
it's
so individual.
kind of a crapshoot.
It is a crapshoot, isn't it?
Well, then we're fortunate to have Bev there to advise them, right?
Yes, we are.
Yes, we are. We're going to take our final break. We'll be back right after these words.
And that's it. The very best thing.
Doc Radio. I can't believe we just got a couple minutes left. We have Dr. Holm here and Bev Cotton discussing many topics, mainly diabetes and how to stay healthy. And Bev really helps diabetics in this community with their health. And because of the knowledge she has, she can share it with them, and it makes a world of difference.
There's been a lot said recently about the Bydureon, Victoza injections that help people. I really like that group of medicines. And then there's a new one that makes you pee sugar. What's your comment about the new pills, new medicines, new injections, new things?
Well, of course, I don't know that there's a lot of research, and I haven't seen what happens, unfortunately for me, is that I may see these patients, they start on these medications, but I don't always see the results, and so that's where the providers see whether they work or not. Of course, there's always going to be new and improved medications, and I think that they're always worth a try. I think, I can't remember which one is the one that you take just once a week.
Bydureon.
Yeah. And I think, even that, we're a society of convenience, and If you can take a medication that you only have to remember to take it once a week versus taking it every day or twice a day or 3 times a day or whatever, and it keeps your blood sugars under control, I think it's great. But the bottom line is no matter what medication you take, you still have to do the basics. You still have to be very careful about what you eat and what you do. That's still, I would say, 50% or more important than the medication you're taking.
I have a case of almost every one of my patients I use metformin because it is the very best drug to make all the systems work better. It doesn't it causes low sugars, helps people lose weight, takes away a little bit of their appetite. It's a wonderful drug.
Cheap.
And it's cheap. Problem is that it does, there's some warnings about it being used in people whose kidneys aren't working as well.
Mm-hmm.
Isn't it interesting how variable that is? One expert will say, doesn't matter, use it anyway. Another says, oh no, if there's any renal function problem, you're going to stop it. Oh, but we'll restart it again in this case. I mean, I find no consistency in the experts on that. And what I've done is I've tried to reduce doses to 500, 250 sometimes.
Yep. In
people who have lower renal function, and monitor carefully.
Yeah.
Is that a reasonable thing to do?
Yeah. In my own personal life, my mom has diabetes and takes metformin, and I haven't seen any change in her renal function, even though she has somewhat of an elevated renal function level. But whether or not she's on the 500 twice a day, 500 once a day, or not at all, I haven't really seen any change in her renal function. So is it affecting it?
Well, but it sure does help the sugars.
It does help the sugars.
Wow.
Is that given mainly to diabetic patients?
Oh yeah, but
Sometimes-
we even use it for people who it helps polycystic kidney disease. I have used it along with Prozac in an off-label way to help people keep their weight down.
And now it's safe to give gestational diabetics metformin. It's not the number one, but I have seen some of my gestationals that
People
have
who
put
are
on.
pregnant
Yeah.
and on it. So that's an interesting medicine. It is, I think, very safe.
And it's been around forever.
It's been around forever.
Now, when you talk about this med, I'll show my ignorance. Does that mean that you take that instead of insulin, or you take insulin too?
Well, actually, they're using it now everywhere because it makes all the systems work better.
So instead of insulin.
So I use it with insulin.
Okay.
Even.
And it depends on where you're at. It depends on where you're at in your diabetes control or your
Yeah.
sugar
If you
control.
abs-
You may not need insulin if you can control it with just medication
Ah,
by
okay.
mouth.
So I commonly will use it in a person whose pancreas is pooping out but hasn't pooped out completely. That's a way of putting it. Bev, would you say it in a nicer way?
She would.
I probably would, yeah.
I know
Yeah.
she
Are
would.
we out of time?
I think we've run out of time, but we sure hope all of you have enjoyed our Prairie Doc radio program, and we'll listen again for Prairie Doc, brought to you by the Avera Medical Group Brookings. As always, you can hear and see more from Dr. Home online at prairiedoc.org. Thanks for joining us today, Bev. It's been a pleasure having you with us.
Thank you,
Thank you.
Joan.
Thank you, Joan. Thank you.
And Bev and Bob, and stay healthy out there, people.